Hello guys, in this video we are going to study about CURB 65 criteria, a topic from medicine. So what is CURB 65 criteria used for? It is used for risk stratification for pneumonia. Now, CURB 65 criteria stands for C stands for confusion, U stands for urea more than 7 millimoles, important, it is 7 millimoles. Respiratory rate more than equal to 30, again very important point because you will make mistakes in it. It is more than 30, right? It is very important, respiratory rate more than 30. B stands for blood pressure, right? So B has two parts: systolic blood pressure less than 90 millimeter mercury or diastolic blood pressure less than 60 millimeter mercury. Any one of them will do, and age more than 65 is the 65 part, right? Now the points assigned to each of them is 1, right? Every point, every 5 components has been given or assigned 1 point. Now you will add up these points on the basis of the criteria, and if the total point comes out to be between 0 to 1, if the total point comes out between 0 to 1, then the mortality in 30 days is 1.5%, right? If the total score comes out to be 2, then the mortality is 9.2%, and if the total score comes out between 3 to 5, then the mortality rate is 22%, right? So generally question will be asked that what will we do when the CURB 65 score is 2 or it is 3 or to 5, then what will we do? Right, if the score is between 0 to 1, we will treat the patient in a home basis. If the score is 2, then OPD basis treatment is done, and if it is between 3 to 5, then IPD basis treatment is done. So it is the important thing, and generally question is asked from this particular part, right? And another type of question that is asked is, they will ask that what is a part of, or what is true for, or what is not included in CURB 65 criteria, and they will generally make you do mistakes in the respiratory rate part or the urea part, right? So it is very important that we discuss the respiratory rate part. So there are 3 respiratory rates in whole of our NEETPG syllabus. That is very important. First is CURB 65 criteria. In CURB 65 criteria, the respiratory rate is more than 30. In Q-SOFA criteria, the respiratory rate criteria is more than 22. And in CIRS, the respiratory rate criteria is more than 20. So this is a very important thing, the respiratory rate part, which I wanted you to know and want you to do a comparative study of it in all these criteria. So that's it guys, everything is written over here that is important. Thank you.